India reported 44,059 new cases and 511 deaths in the last 24 hours. That's 2.5% lower than yesterday. Over 91 lakh people have been infected by COVID so far, of which 1,33,738 people have lost their lives. The total number of tests conducted in the last 24 hours has been 8,49,596. So that's below the 1 million mark or 10 lakh mark that is expected. And the positivity rate has gone up slightly to 5.1%. If we talk about the states that are worst affected, Delhi topping both lists in terms of daily cases and deaths being reported. Delhi reported 6,746 cases, followed by Maharashtra, Kerala, West Bengal and Rajasthan with 3,260. And Delhi reporting 121 deaths, followed by Maharashtra, which is reporting 50, West Bengal 49, UP 35 and Kerala 27. So all of them in double digits, Delhi in triple digits. Now the Supreme Court today, in fact, stepped in on the matter of the coronavirus crisis in the country, and it's now sought status reports from Delhi, Gujarat, Maharashtra and Assam in 2 days' time over the spike of cases in these states, and it's going to take up the issue again on Friday. And they've warned that worse things will happen in December if states aren't well prepared. The court took up the issue on its own and said the COVID situation in Delhi is worsening. So that'll be interesting to see the reply from the states in 2 days' time. And several states have announced restrictions. So let's just take a look at the measures announced across the country. States like Rajasthan, Madhya Pradesh and Gujarat have announced night curfews. And there you can see in Rajasthan prohibitory orders in all the districts. There's also markets and restaurants to close at 7 p.m. now. There's a night curfew in several of the top cities: Jaipur, Jodhpur, Bikaner, Udaipur, Ajmer, Kota, Alwar and Bhilwara. And the decision to reopen schools and colleges is on hold, and a fine for not wearing masks has been raised from 200 to 500. State government employees to be called on rotation. Now, if we talk about Madhya Pradesh, schools are going to be shut till the 31st of December. There's night curfew between 10 p.m. to 6 a.m. also in several of its top towns, and in Gujarat as well. Ahmedabad has a full weekend curfew, and a night curfew has been announced for Surat, Rajkot and Vadodara, and the decision to open schools and colleges has been put on hold. Well, to talk about these restrictions and night curfews and what really works in countering the spread of coronavirus, we're joined by Dr. Hemant Deshmukh, Dean of KEM, and Dr. Rachna Kucheria joins us again on this issue as well. Dr. Deshmukh, first to you. The COVID cases are spreading. Uddhav Thackeray, the Chief Minister of Madhya Pradesh, in fact, has warned that if people aren't careful, a second or third wave could be like a tsunami of cases. So what is your view on these restrictions, these night curfews? Because there's a lot of criticism as well, saying how do these really work? How do these kind of restrictions help in controlling the spread of the disease?
Good afternoon, everybody. The whole idea of imposing a night curfew is very simple. This is to ensure a compulsory social distancing amongst everybody. Now, when we say night curfew, most of the people who are working during the day are going to go back to their homes and really have a self-imposed night curfew. Now, if this night curfew is imposed during even the daytime, I think that would work wonders. But we should not underestimate the benefits of social distancing during the daytime also. Now, three things which time and again we have been telling each and everyone within the city of Mumbai, within the state of Maharashtra or any citizen of India, is that social distancing, hand hygiene and wearing a mask is going to be the main gates of keeping the pandemic away.
All right, Dr. Rachna Kucheria, your view on this, on restrictions and lockdowns. This has been something that has been so debated, by everybody. And I know it's a choice between lives and livelihoods, and restrictions and any sort of lockdowns are always criticized. But given the increasing cases for the moment, as a first step, what is your view on these night curfews?
I think exactly as the doctor from Mumbai said, that the three mainstays remain in the hands of the people: the mask, the social distancing, and washing of the hands. As far as lockdowns go, the purpose, it will not stop the infection. All it does is delay the spread, slow the spread. So if districts or states or local areas need time to shore up resources because the infection is now getting too out of hand, hospitalizations are too much, oxygen demand, ICUs, all of that is too much, then perhaps some restrictive measures can be used. But otherwise, in my opinion, I think, as you said, the balance of lives and livelihood, a little bit of cajoling, a little bit of restriction, a little bit of creative messaging, combine all this, and it's a slow cultural change that is needed with the people. A quick example, in the case of SARS and the the epidemics in Korea and China 10 years ago, it's now their mask usage in South Korea is about 98%. So it's taken them that long to get to it. It's a cultural change we're looking at. It's not going to happen tomorrow. So we need to continue to persist despite all kinds of fatigues, get the right messaging out, do it in different ways, do it creatively so that the people do take the responsibility for their role. And then the governments take responsibility. If you're going to do lockdowns, then you have to make sure that people are fed and watered in their homes. So those need to be balanced, I think.
Absolutely. Dr. Deshmukh, given, as Dr. Rachna said, that people need to be more disciplined, etc., it seems that when the restrictions started getting lifted, it almost seemed like people felt, oh, it's over, the government isn't restricting us anymore, and they're the ones who are heading out. So in that sense, there's night curfews and restrictions and sort of bring back that sense of, yes, there is an issue, there is a crisis, so we must be more disciplined. At least in that sense, it works.
Yeah, Gargi, what we need today is mass communication. The mass communication can be enforced within the city of Mumbai or Maharashtra or India. But the people of India are not going to listen to any kind of restrictions. They are going to have a field day. And when we say that COVID-19 is still not over, the understanding has to be deep-rooted within the citizens of Mumbai. And or in fact the entire country. When we say that night curfews are on, it simply means that the movement within the small periphery of their houses is restricted. But the entire communication, the entire traveling, the entire coming together in weddings is still not restricted. If you realize that the weddings are happening, now there is a maximum cap of 50 people for a wedding ceremony. But these caps also, if they are removed, the cinema halls are also open, the temples or the places of worship are open. I think if we can restrict and go back to the original plan of restricting movement of people, I think that's the only way that we can win over the pandemic.
Right. Dr. Rachna, your view on how the Delhi government, even though we're seeing the maximum daily cases and deaths, it still insists that there's going to be no sort of lockdown.
I imagine that means, I can't speak for the government, but I imagine that means sort of a broad lockdown of the kind that we saw very early on in the pandemic. And I'm sure on their part, they're trying to balance the lives and livelihood of people. But I do agree with the doctor from Mumbai that certainly some discretionary indoor gatherings, and I call these discretionary, cinema halls, wedding parties, even religious places, temples, mosques, churches, everything included, indoor places, there could be restrictions and curbs there, shutdowns there. But perhaps, giving a little more flexibility where people's livelihoods are concerned. So I think that's the balancing act that the government will have to do. And people, from a personal, individual and a societal aspect have to step up to the plate. Messaging needs to be simple, clear in people's language that there is no option to the mask. As I said, some they've imposed heavy challans. That is sort of the punishment aspect of it. But some has to be cajoling and creative messaging to the people so that the message stays with them and they actually make that change in their lives.
All right. Thank you so much, Dr. Rachna and Dr. Hemant Deshmukh, for joining us on the show today.
Thank you.
Well, to now speak about the issue of whether people support restrictions and lockdowns, Web portal Local Circles conducted a survey this month to understand the views of residents of Delhi on how the current situation should be managed. This survey was done post-Diwali and it asked that whether there should be some sort of lockdown brought in. Now, in response, 34% of Delhiites in this survey voted for a 3-week immediate lockdown with only essential services to function. 40% said no lockdown, but a 3-week shutdown of markets and non-essential shops. Over 70% are in this survey at least support some sort of restrictions being brought in. To talk more about this, we're joined by Sachin Taparia, founder and chairman of Local Circles. Tell us, how big was the number of people that you surveyed and what kind of questions did you ask them?
So we actually did two surveys, Gargi. One was a national survey to get a sense of, what should be the way forward. And one was a Delhi-centric survey. And in total, we had about 30,000, participants from across the country and 10,000 specifically from Delhi. And, it seems very clear that, national lockdown is not an option. And there's about 60 to 65 districts in the country now where you have, post-festival surge and over 1,000 active cases. Delhi obviously is leading the charts over there. And the concern that people have is that, if nothing is done here in terms of restrictions, you would have, serious issues and shortages from a health infrastructure standpoint. And, going into the winter season now, if this continues and we hit, let's say, the 10,000 or the 12,000 daily case load, we would not be able to find, enough COVID ICU beds in Delhi. So very clearly, people are in favor of some kind of restrictions to be imposed in Delhi. Nationally, though, in the mood is that, look, if you have 60 to 65 districts across the country, out of the 736 districts, there could be localized lockdowns, restrictions, market shutdowns to control the surge and to get to a point where, the decline that we saw in late September into early October before the Navratri started, continues and India gets to a better place.
Right. And just briefly, Sachin, this whole issue of how with restrictions being lifted, people are not taking responsibility, it seems, and acting as if the pandemic is over. So do you think restrictions, at least, I asked this to the doctors earlier, at least brings a little bit of pressure? It gives people a sense that, yes, there is a crisis.
Yes, but I think some of it is also due to the fact on how the communication has gone through, unlocking 1, 2, 3, 4, 5. And a lot of people basically are, ended up believing that now, it's over, things are getting better, they can actually go out. And therefore, I think a lot of people are now going out. They're saying, look, Corona is gone, everything is open, right? So I think that is something, again, that has got to be communicated effectively. And, if restrictions have to be imposed, they have to be very, very strict. I think that is the key difference here. That, if for example, this morning we came to know on local circles is that, people in Delhi are actually, booking, making 3 bookings for a wedding in a hotel and ended up calling 150 people, right? So these kind of things, will continue unless we have strong restrictions and rules that back those restrictions.
All right, Sachin, thank you so much for joining us on the show again to talk about this very, very vital issue. Well, with that, time for us to slip into a short break. Coming up on the other side, our viewer question segment, and Dr. Mufazzal Lakrawala joins us to answer all those questions for you. Welcome back. Well, it's time now to take our viewer questions. We're joined by Dr. Mufazzal Lakrawala, Director of Surgery, Sir H.N. Reliance Foundation Hospital. Thank you so much, Doctor, for sparing your time. Let's just play out that first question.
Hi, my name is Atish Kumar Singh, and my question is, can mosquitoes or ticks spread the virus that causes COVID-19? Thank you.
Hi, Atish. Thank you for your question. And I believe that mosquitoes or ticks can probably spread dengue or malaria, but not corona. So please be completely clear your mind out of this, that there's no chance of the coronavirus spreading. It's more likely that you're in close proximity of someone who's having corona without realizing it and getting corona that way. But mosquitoes and ticks cannot spread corona.
All right, well, let's play out the second question.
My name is Dipti Vedpata, and my question is, my child is underlying medical conditions. So what additional steps should my family take during this pandemic? Thank you.
Dipti, your question is like as great a question that anybody should be using. Please don't throw precaution through the wind, whether your child has an underlying medical condition. I don't know what it is, but whatever it is, please, the precautions that you need to take are more important than the precaution your child needs to take. You need to protect your child. So firstly, protect yourself. Mask always. wherever you are. Please keep social distancing, sanitize your hands as much as possible. Use all precautions, all universal precautions. Until this virus remains around for another 6-8 months, I believe, please use as many precautions as you can. Don't throw precautions to the wind. Avoid crowded places, avoid public gatherings, and keep as much of distance from another individual as possible.
Right, and that, doctor, goes for everybody who has, especially if you live in a joint family, you have grandparents, etc. That's the worry, that people go out and come home. What sort of precautions should they take if they have no choice but to go to work and then come home? But how do they protect themselves before they enter their house?
I think I've always said, protect yourself first to protect your family next, and to protect your country finally. So if you don't protect yourself, there's a very likely chance that you'll be the person responsible for infecting your loved ones, or for it, be it a kid or be it someone old enough in your family. They would have never stepped out, but would probably have a burst-off effect with that corona rather than you would. So please remember that you have to protect yourself first and foremost, and then protect your family next.
All right. Thank you so much, Doctor, for sparing the time to answer those questions. And finally, here's an example from the US, which really drives home this point of avoiding any kind of gatherings, because you don't know who you could then endanger. So there was a small wedding that took place in Maine, and this goes to show how you should avoid gatherings outside your bubble. The wedding is tied to the state's largest outbreak of COVID now, and the number of cases involved is still rising. The wedding took place on August 7th. 62 guests mingled and danced and dined, and one of the guests had coronavirus. Clearly, as of November 12th, the health authorities have now identified 178 cases which are connected to people from that wedding. And now at least 7 people have died, 3 others have been hospitalized, and none of these people attended that wedding. They apparently contracted the virus from someone who did attend that wedding. So as the doctor said, protect yourself to protect your family, and then to protect the public at large. So do wear masks, avoid large gatherings, and do social distance. Just take a look at how it all started with that wedding, 62 people attending it. It then spread with 178 people getting infected, and 7 people who didn't even attend the wedding have now died. Well, that's all the time we have on the show today. Thanks so much for watching. Goodbye.